Welcome to ASWB Bachelor of Social Work Exam Practice Test. Our topic today is interventions with clients or client systems. Use the link in the description to download the app on the App Store for free practice tests. Number 1. Youth who become violent before which age generally commit more crimes? A. Age 13. B. Age 18. C. Age 25. D. Age 27. The correct answer is A. Age 13. Explanation. Youth who become violent before age 13 generally commit more crimes and more serious crimes for a longer time. These youth exhibit a pattern of escalating violence throughout childhood, sometimes continuing into adulthood. Number 2. After conducting the assessment, coming up with and implementing an action plan, what should the social worker do? A. Assess lethality. B. Refer the client to a psychologist. C. Make psychological contact. D. Plan follow-up. The correct answer is D. Plan follow-up. Explanation. While there are many theories used to explain and address crises, there are 7 critical stages through which clients typically pass on the road to crisis stabilization, resolution, and mastery. These stages are essential, sequential, and sometimes overlapping in the process of crisis intervention. Planning follow-up is the final stage of this process. Follow-up can take many forms, as it can involve phone or in-person visits at specific intervals. A post-crisis evaluation may look at a client's current functioning and assess a client's progress. Number 3. In which step of the problem-solving process do clients evaluate the effectiveness of the treatment as well as anticipate expected future support if needed? A. Intervention. B. Evaluation. C. Termination. D. Engagement. The correct answer is C. Termination. Explanation. There are 6 steps in the problem-solving process, including engagement, assessment, planning, intervention, evaluation, and termination. In termination, a client should reflect on what has been achieved and anticipate what supports are in place if problems arise again. Although this is the last step in the problem-solving process, it still requires active involvement by both a social worker and client. Number 4. Which of the following is not a type of role modeling? A. Participant modeling. B. Symbolic modeling. C. Live modeling. D. Positive regard modeling. The correct answer is D. Positive regard modeling. Explanation. Role modeling emphasizes the importance of learning from observing and imitating and has been used successfully in helping clients acquire new skills, including those associated with assertiveness. There are different types of modeling, including live modeling, symbolic modeling, participant modeling, or covert modeling. Number 5. Which is not true about crisis intervention? A. Crisis intervention is a long-term approach. B. Crisis intervention focuses on the here and now. C. Crisis intervention requires high levels of activity and involvement from a social worker. D. Crisis intervention is directive. The correct answer is A. Crisis intervention is a long-term approach. Explanation. Crisis intervention focuses on the here and now, is time-limited, most crises last from 4 to 6 weeks, is directive, and requires high levels of activity and involvement from a social worker. A social worker sets specific goals and tasks in order to increase a client's sense of mastery and control. Number 6. Which of the following is not true about psychotherapies? A. Psychotherapy helps clients manage their symptoms better and function optimally in everyday life. B. Sometimes, psychotherapy alone may be the best treatment for a client, depending on the illness and its severity. C. Medication should not be used when clients are treated with psychotherapy. D. Psychotherapy aims to treat clients with mental disorders or problems by helping them understand their illness or situation. The correct answer is C. Medication should not be used when clients are treated with psychotherapy. Explanation. Psychotherapy aims to treat clients with mental disorders or problems by helping them understand their illness or situation. Social workers use verbal techniques to teach clients strategies to deal with stress, unhealthy thoughts, and dysfunctional behaviors. Psychotherapy helps clients manage their symptoms better and function optimally in everyday life. Sometimes, psychotherapy alone may be the best treatment for a client, depending on the illness and its severity. Other times, psychotherapy is combined with the use of medication or a psychopharmacological approach. Number 7. What often occurs during the contemplation stage of change? A. Denial of the problem. B. Ambivalence. C. Feelings of frustration. D. Experimenting with small changes. The correct answer is B. Ambivalence. Explanation. Usually change does not occur easily, and there are stages of change that occur. Understanding these stages can help achieve goals. 1. Precontemplation. Denial, ignorance of the problem. 2. Contemplation. Ambivalence, conflicted emotion. 3. Preparation. Experimenting with small changes, collecting information about change. 4. Action. Taking direct action toward achieving a goal. 5. Maintenance. Maintaining a new behavior, avoiding temptation. And 6. Relapse. Feelings of frustration and failure. Number 8. Group work is contraindicated for whom? A. Clients who are pregnant. B. Clients who are compulsively needy for attention. C. Clients who are under 18. D. Clients who have lived alone for a long time. The correct answer is B. Clients who are compulsively needy for attention. Explanation. Group work is a method of working with 2 or more people for personal growth, the enhancement of social functioning, and/or for the achievement of socially desirable goals. Contraindications for group work include client who is in crisis, suicidal, compulsively needy for attention, actively psychotic, and/or paranoid. Number 9. Which of the following is not true about an interdisciplinary approach? A. It is challenging. B. It creates cross-fertilization of skills between professionals. C. It is cost-effective. D. It is time-limited. The correct answer is D. It is time-limited. Explanation. Interdisciplinary teams are often seen as advantageous to clients because they do not have the burden of navigating multiple service systems and communicating to multiple professionals involved in their care. Interdisciplinary teams can also be cost-effective and can increase positive outcomes. Creating cross-fertilization of skills between professionals is another benefit of an interdisciplinary approach. However, interdisciplinary collaboration is a challenging social work activity. Number 10. Which of the following can reflect social workers' competence and the value of social work services? A. Good organization of client files. B. The time they have worked for the agency. C. The quality of written reports. D. The number of clients they provided services for. The correct answer is C. The quality of written reports. Explanation. Social workers' competence and the value of social work services are often judged by the quality of written reports. Thus, it is essential that thought and care be taken in their preparation, and that they adhere to best practices and standards. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.